For every leader in pharmaceutical R&D, let's be clear. The conversation around artificial intelligence has moved way past potential. It is now a strategic reality. We're no longer asking if AI is going to reshape our industry. The real question, the one on every leader's desk, is how we are going to architect that transformation. The upside is just immense. We're talking about accelerating drug discovery, gaining incredible clinical insights, and delivering truly personalized patient care. But for us, operating in the most regulated GXP environments on the planet, the biggest challenge isn't the technology itself. It's making sure that every single AI-driven step we take is compliant, validated, and de-risked from day one. This is our playbook for doing just that, for harnessing all that power while reinforcing the very foundations of quality and regulatory integrity.
So, the first thing we have to get right is our mindset. The best way, the only way, to think about AI is not as a replacement for our brilliant scientists and clinicians, but as the ultimate co-pilot. This quote from NPJ Digital Medicine just nails it. The goal here is augmentation. AI is a tool, an incredibly powerful one, that's designed to boost human expertise. It empowers our teams to hit new levels of precision and efficiency they couldn't before. It's all about elevating our collective genius, not trying to automate our professional judgment. Now, with that principle in mind, let's look at what this really unlocks.
The first and maybe the most game-changing impact is on the sheer speed of discovery. Generative AI is already pinpointing new therapeutic targets at a pace we couldn't have imagined just a few years ago. And it's not just identification. It lets us create digital twins, these incredibly detailed simulations of patient biology. Just think about what that means. You can test drug mechanisms, you can predict how a disease will progress, all in a virtual environment. This doesn't just cut down development timelines, it lets us fail faster, cheaper, and smarter, so we can focus our best resources on the candidates that have the best shot at success.
Okay, so that's discovery. Now let's see how that power scales up in the clinical space. The real magic of AI here is its ability to synthesize just massive amounts of complex data. There was a recent study that showed GPT-4 could match the diagnostic accuracy of radiologist residents by analyzing patient history and imaging results together. Now, this isn't about replacing the radiologist, not at all. It's about giving them an analytical partner that can cut through the noise, distill data into clear, actionable insights, and free them up to focus on the toughest, most nuanced decisions. It's literally the definition of turning data chaos into clinical intelligence.
And this perfectly illustrates the impact you can have right at the patient level. On one hand, AI can take complex medical information and tailor it to a person's specific health literacy or cultural background, which can make a huge difference in comprehension and adherence. And on the other hand, it can streamline those notoriously painful administrative tasks, like drafting the initial paperwork for insurance authorizations. When you cut down on that administrative burden, you're giving your clinical teams back their time and energy to focus on what really matters and what will always matter: direct patient care.
The promise, then, is crystal clear. It's compelling, but for every one of us leading in a GXP-regulated world, this incredible potential runs smack into the single most important hurdle we have to clear: the new validation challenge. This is the question, isn't it? It's the first thing our quality assurance teams will ask. It's what regulators are going to demand a bulletproof answer for, and frankly, it's what our own standards of excellence require us to satisfy. For any new piece of tech that enters our workflow, this question is the ultimate gatekeeper. And with AI, the answer just isn't as simple as it used to be.
Now, what's so important to grasp here is the fundamental shift in thinking this requires. For decades, our validation models were built for what we call deterministic software. You input 2 plus 2, it gives you 4, every single time. Validation was a straightforward, one-time, pass-or-failed test. AI systems are completely different. They're probabilistic. They don't calculate an answer, they predict an outcome based on patterns. So our whole concept of validation has to evolve. It's no longer a one-time test. It's an ongoing performance evaluation. We're basically moving from validating a calculator to validating the judgment of a constantly learning expert.
And that probabilistic nature leads us straight to our next critical job as leaders: governing a system where the internal logic isn't always obvious. You've heard it called the black box problem. But instead of seeing it as a roadblock, we should treat it with disciplined risk management, the same kind of rigor we apply to every other complex system in our R&D pipeline.
A huge operational risk we need to manage is something called model drift. So imagine you train an AI model on clinical data from 2023.
It works great. But what happens in 2025? Clinical practices shift, patient demographics shift, maybe even the way we enter data evolves. The model's predictions can become less and less accurate. Why? Because the real world has changed and the model hasn't caught up. The takeaway here is that governance can't be a static check-the-box exercise. It has to be a continuous process of monitoring to catch and correct for this inevitable drift.
So let's break down the 3 primary risks that should be on every executive's dashboard, along with how to mitigate them. First up, model bias. If you train a model on data from North America and deploy it in Asia, its performance could drop. The mitigation is process-driven. You have to continuously monitor performance by geography, by document type, whatever the segment is, and be ready to retrain with more representative data. Second, automation bias. This is a human problem, our tendency to just over-trust an automated system. The fix is operational. Build randomized, tough human QC checks right into the workflow to stop people from just rubber stamping the AI's output. And finally, data misuse. As leaders, we have to do exhaustive due diligence on our AI vendors. We need it in the contract that our proprietary data will never be used to train public models. Demanding certifications like ISO 27001 or SOC 2 is the absolute minimum, a non-negotiable starting point.
Actively managing these risks doesn't mean we shy away from the technology. Just the opposite. It leads us directly to the most robust, most defensible framework for using AI in our industry, the human-in-the-loop imperative. This is the model that guarantees accountability and really turns AI into that powerful co-pilot we were talking about earlier.
The human-in-the-loop model, or HITL, is both elegant and incredibly effective. It's a simple 3-step process. Step 1, the AI analyzes the data, makes a suggestion, and, this is key, provides a quantifiable confidence score. Step 2, a human expert confirms that suggestion, and critically, if the AI's confidence score drops below a threshold we set, say 85%, the system requires a human to step in. The final call always belongs to the human expert. And step 3, every single part of that interaction, the AI suggestion, its confidence score, the human's final action, is logged in a transparent, unchangeable audit trail. It creates the exact kind of record that regulators need to see.
This quote just sums it up perfectly. AI suggests, humans confirm. This model puts the final accountability exactly where it should be, with our trained, experienced professionals. It turns the AI from some autonomous decision-maker into a hyper-efficient assistant, giving us all the benefits of speed and scale without ever compromising our regulatory integrity. This is the foundation of responsible AI. So, with that governance framework in place, how does an organization actually get started? I know the idea of implementation can feel daunting, but this doesn't have to be some massive disruptive overhaul. Success here comes from a phased, strategic, and really well-governed approach. Here's a practical roadmap we can use.
First, you lay the groundwork, and notice this starts with people and process, not technology. You establish a cross-functional AI governance body, you update your SOPs to officially include AI-assisted workflows and that human-in-the-loop model. And maybe most importantly, you educate your teams. You have to champion AI as a tool that frees them up from repetitive work to focus on higher value, more strategic thinking. Second, pilot smart. Don't try to boil the ocean. Pick one well-contained process, one study, and then measure everything. Benchmark its accuracy against your manual process, calculate the hours saved, get feedback from the users. A successful pilot gives you the hard data you need to build the business case and earn internal trust. And finally, you scale with confidence. You take what you learn from the pilot, refine your processes, and then you expand methodically. Start with lower risk functions and move toward the more high-impact applications. That's how you make sustainable, risk-managed progress.
And that brings us right back to where we began. The adoption of AI in pharma R&D is no longer a question of if, it's only a question of when and how. This technology is one of the most powerful levers we have to get life-saving therapies to patients faster. But to realize its full potential, we need more than just a tech investment. We need proactive, principled leadership. We have to build the frameworks for validation, for governance, for human oversight. The bottom line for every leader listening is this: the time for watching from the sidelines is over. The question you have to ask yourself now is, are you going to architect your organization's AI future, or will you be forced to react to one that was designed by somebody else?